Hello, beautifuls. Welcome back to my Chanel, and welcome to probably the first video I'm actually successfully filming in October, and that's because YouTube got me, girls. YouTube got me. I had 3 videos. Well, 2 videos fail. 1 actually uploaded. My last video here, which was about America's Next Top Model, YouTube decided to very kindly, I love it that they did this to me, it's so helpful, to kindly cut off the last like 8 minutes of the video so you didn't get to hear my final thoughts. But nevertheless, do not fear, even though it's spooky Halloween season, I will be putting that into the next America's Next Top Model video that we will be doing so you can hear my thoughts about the Shandy drama. Praise Satan. So, my loves, it's actually been a month since I have done one of these videos, those Dr. 90210 videos. These are kind of my favorite plastic surgery videos that we do here on my Chanel because it kind of gives you the most well-rounded, decent kind of experience of plastic surgery. It gives you almost like a backstage pass, very Alton Towers. Don't look down. Into the lives of plastic surgeons and how they view their work on their patients. And for the majority of the time, it's actually really quite useful and helpful to know that they really care and that they're very excited about the work that they do. However, the drama surrounding Dr. Rey is always a little bit uncomfortable, shall we say.
Naughty mummy.
So one of the top comments on the last episode of Dr. 90210, girls, was by Siobhan Topping, and they say, I always wish that Dr. 90210 would focus more on the patients and their surgeries rather than on the Rey family. Robert is insufferable. Robert. I love that you're covering this series. It's like showing a new friend an old favorite. Well, my lovely, thank you so much for your comment. I completely agree. I do kind of wish that they would focus more on like making sure that the before and the after kind of look most accurate. They kind of do this weird thing where they follow the patient around in their, I was going to say in their afterlife. That's not quite right. Death! They go and follow their life post-surgery and then just show you like a fully made up, candid shot of their after, rather than more of a more medical shot that we see in like the before sections. But I do understand that this is also a TV show and it's a reality TV show at that. It's not necessarily about like, this is what happens with successful surgery, girls. I understand it's not quite that. So, my lovelies, without any further ado, are we ready to watch another episode of Dr. 90210? This one is titled Models Staying Beautiful. And I can just about tell you that I feel like this one might be one of the most controversial episodes just from that alone. Models staying beautiful. We're doing a lot of models at the moment on the Chanel, aren't we? Okay, my loves, grab a beverage. Probably don't get anything to eat because these ones are quite graphic, even though I can't really show anything here on YouTube. Hello, whose pussy is this? Da, 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 da. Da, da. Oh, a Jimmy Choo, girls. This intro, as I've said before, is just so solemn and soft for the level of, like, body modification we're seeing in this show. An eyelash, some lipstick, and a curve around the neck. Palm trees, Dr. 90210. Isn't that just wild? Absolutely wild. Okay, so where are we today? Tarzania, California. She is gorgeous. Look at those cheekbones. Okay, so, oh, quite a lot of surgery is wanted here.
My name is Kimmy. I'm getting my nose done, my chin done with a breast augmentation and a little lift on the left side.
And a lift at the same time. Let's just have a little look-see there. So, Kimmy here is kind of getting the same sort of plastic surgery that I had in my facial feminization surgery. So I had a nose job and I didn't have a chin implant. I had my chin brought forward. So that's kind of relatable. I can't imagine having that and that done and a breast augmentation at the same time though. That's like fully like...
Tonight on 999. I can't move and I'm upset.
Augmentation and a little lift on the left side. I'm trying to get back into the modeling game. And the features that I do have, I want to...
Trying to get back into the modeling game? I'm going to ask you guys a question. Should models get plastic surgery to further their career? I bet it happens all the time. I bet like every single model has got like a plastic surgery or like a modification story in order to further their career. But, like, do you reckon it happens, like, constantly?
And the features that I do have, I want to just bring them to the best that they possibly can be.
Okay.
This is the bridal company that I used to model for.
Bridal?
I did a lot of runway shows for them, and we did this photo shoot.
I never got an agent or a manager or anything like that. I just got odd jobs here and there just from word of mouth.
Hang on a little finger-licking moment. Ugh.
Disgusting.
So Kimmy here has done like side jobs of modeling and sort of like previous modeling for bridal, runway, and a couple of photo shoots. And she says that she's never had an agent and never had management, but she wants to get back into the modeling career. I feel like this is a lot of plastic surgery for essentially what is a hobby if you're only getting odd jobs through word of mouth. I don't know how I feel about that. Do you think that that is unusual?
Quite the scandal, actually.
So I have basically done the same sort of amount of modelling as Kimmy here has. I've actually modelled a bridal gown once. I had a photo shoot with it, and I've had a few runways in my career. Never been paid for any of them, and it's always been like odd job, hobby type things. The idea that she wants to get breast augmentation, a nose job, and a chin implant for getting back into the modelling, what did she say? Getting back into modelling gigs. It's kind of a bit, I feel like that's a bit much, don't you? You should do it because you want it, not to get a career. I don't know. But then again, even though I love this TV show and I feel like this TV show is the most like well-rounded look at plastic surgery, it is still a reality TV show, so they will have, what do we call them?
Storyline producers.
We love those from America's Next Top Model, don't we, girls?
I went around to a couple different agencies and went and did some test shooting. People either didn't like the makeup, or they didn't like the hairstylist, or they didn't like the photographer. It was one or the other to why they didn't like my pictures. It gets a little tiring when it comes to that.
Oh, I don't know. Hang on here. If we're I don't know whether I should be. I'm going to try and pick my words very, very wisely here because I do not want to come across as unkind to anyone. But, how can I say it? Not everyone is meant to be a model. And if you've had multiple photo shoots and multiple interviews with agencies and no one is seeing that career path happen for you, perhaps a different career path might be more beneficial to your mental health and your ability to earn money in this world. There is a level of, I don't know. There's certain people you'll meet along the way in life, especially if you're in the beauty industry in any way, shape or form, that are just like,
I'm going to be a model. I'm a model. I'm going to be a model. I'm so famous. I'm going to be a model.
And they never do. And it's almost a level of delusion. There, I said it, delusion. But I'm going to keep an open mind for Kimmy here. But I do also think that you shouldn't be getting huge amounts of plastic surgery if it's for a career and you've already had rejection in that career that's kind of stopped it from being a career. Do you know what I mean? Like, no one's going to hire you because you've had a nose job.
It gets a little tiring when it comes to that.
See, this picture right here will be no more. I will have nice, voluptuous breasts.
Also, a lot of like modeling places don't want you to have like nice voluptuous breasts. They want you to just be like a basic canvas so that all the clothing will look gorgeous upon you. Bums, Harry Winston, Chanel girls. Dr.
This is
Rey.
Christine. I'm calling you back from Dr. Robert Rey's office.
Dr.
Look
Robert.
at this mirror and tell me, what about your nose
She's so-
you don't like?
Right.
Just the little, what is that, a little lump, I guess you would say, on each side.
Right.
And just it's a little pudgy right here.
You know what? I agree with you. We take a little bit of that.
She's got a degree. She's actually got like a really well-rounded idea about what she wants from her nose job. So that's actually quite interesting because that kind of mirrors my experience with my nose. I had a rhinoplasty in my facial feminization surgery, which is a set of procedures to feminize the face. My nose wasn't exactly masculine, but as we were shrinking other parts of my face and kind of like feminizing everything else, my nose would have been left behind and it would have looked big and out of place. So I just went for a very, very slight adjustment, as slight as I possibly could, because I didn't want to look like a completely different person. I literally just had a bump on one side of my nose that I wanted reduced, and I wanted my tip refined, pointed, and slightly upturned, and I wanted the most delicate, not extreme, not dramatic, the most subtle little feminine curve. That's what I wanted. It's very Eurocentric beauty standards, but guess what? I'm from Europe.
How could you do this to me? Question mark.
So I'm interested to see what Dr. Rey is going to say here, because we know how he feels about feminine qualities and what he deems to be feminine when he said a couple of episodes ago,
We've got a generation of unfeminine, flat-chested women.
It's because you're really flat-chested.
Fatty tissue out of here. And then we take a little bit of that cartilage out of here, and that makes your nose a lot
this is how...
The nose a little bit
That is the same kind of nose job that I had.
serious, but the breast's a lot of fun. You do have that little defect there. One breast is a little bit fuller than the other. She has Poland syndrome, which means one breast is very small, constricted on the side. The other breast is more normal. So a very, very beautiful girl with a few defects.
Let's say.
Oh, Dr. Rey really doesn't... He doesn't pick his words very nicely, does he? Very beautiful girl with a few defects. He could have used any other word in the world there. He could have said, she was a very beautiful girl and she just wanted a few changes. Defects. That's an extreme word.
Let's say somebody's 9, 10 being the most beautiful. And if you just tweak it, enhance it, that one little thing which bothers a patient, it gives them the confidence, because now that imperfection is no longer there in their eyes.
True. Well, that's very true, actually. I do think that the best kind of plastic surgery is when you see people making millimeter changes, like when we're talking about cosmetic plastic surgery, I guess. Tiny, minuscule millimeter changes, when you're talking about like 2 or 3 millimeters in certain places changed, makes a massive difference to the overall picture. There is something that comes to plastic surgery when it's just like some people are looking to be a completely different person, and there are reasons behind why that is like not gonna happen and not a good thing, because there are a few examples I can think of in which, well, they're quite extreme examples actually, especially if you surf Instagram or TikTok, you'll see them quite frequently. They are people who chase an aesthetic ideal to almost look like a completely different person than the person that they started with. Spoiler alert, they always end up becoming a bit addicted to plastic surgery in a way that is no longer healthy and also doesn't produce an aesthetically pleasing outcome, I guess. Beauty is in the eye of the beholder and all that sort of thing, but I feel like we can collectively understand that if you have to undergo 8 nose jobs and you have a hole of necrosis rotting into your nose because you're having too much tissue taken away from your nose in your pursuit of the tiniest nose ever, there might be something else that needs addressing first before your 9th nose job.
What are your thoughts as far as size? What was running through your head?
I just want to be proportionate again, so that's why I'm not going huge, I'm just going natural. Pretty much a full C, maybe a small D to where I was before.
That's before? I wonder what happened before. So that is what I'm getting done. This is very strange. I'm having a bit of an out-of-body experience in this episode, because this is exactly what I'm getting done. On the 18th of November, which is about 4 weeks away now, I am getting breast enlargement to a full C/small D. I'm getting 375 cc's of silicone under the muscle, and I am so excited for it. I cannot wait to have like gorgeous... I'm wearing a push-up bra now, as you can see, but I cannot wait to just have like a gorgeous chest. So my heart goes out to Kimmy here, because that I feel like is a nice natural size. It's quite full, but it's still in the realms of natural.
Chin, I think you have...
I don't have anything against like unnaturally large size breasts, by the way. I love a bimbo look. I feel like if you want to pursue the bimbo look and you look absolutely wild doing it and you're having the best time of your life, make that money, sis, because Instagram loves that. They're going to push your content out everywhere.
Mary has had surgery on her vagina to gain what she calls the fattest vagina in the world.
You have a beautiful face. So I want you to relax your jaw for a second and look this way again. And you're missing about 3 millimeters. Since you're just a few millimeters, we can actually do it with a little implant.
Chin implants.
I have several types of implants. It depends what kind of look you...
For 3 mils, would we actually do that now? Would we do a chin implant for 3 mils? Wouldn't we just like opt for some longer lasting filler maybe? I mean, I've had some filler in my chin done recently, and it's still a bit swollen. I had 1 mil and it changed the shape, just rounding off the edge here and pointing it out slightly so that I don't have my dimple anymore. Can you see? My dimple is gone now, and I love it.
The actual chin implant...
This video is all about me. All I've done is talk about me and my surgery.
You horrible, horrible girl.
Implant is actually see-through. It's just silicone.
A silicone
into
implant.
A chin. Look at Molly Sims. Look at Cindy Crawford. Some of our top models have a slightly squarer jaw. Models and actresses come to me all the time to get the edge on the competition.
Tiny changes can really change somebody.
Yes.
And it's amazing what very well...
I really like Dr. Elbow. He always... Ellen Bogan. He always says, like, really sensible, calm things. Exactly what I want to hear from a plastic surgeon. I want to hear the phrase, small, delicate, concise changes that create a better, improved overall appearance. I want to hear that. I don't want to hear, like, oh, yeah, let's just
take 9 millimeters off your eyeball and plop it on your elbow. Look at me.
Hey, wow, I didn't like that.
Oh.
Okay.
Little tweaks of people's countenance and features can make.
We're just gonna enhance a little bit what you already have.
Right.
Awesome
I'll be
to
back
see.
here on Monday.
Oh, she's tall.
Victoria, how are you?
All right.
Awesome to see you. I'm sorry I'm running.
Hello. I thought it was Janice Dickinson for a moment.
Surgery is so seasonal.
My name's
Wait, he was late to the appointment? What was that?
Surgery is so late. Plastic surgery is so seasonal.
Sorry, I was so late to the appointment. Plastic surgery is so seasonal? Sure.
My name's Victoria Jacobs. I've always had pretty plump lips.
She wants
but as you
plump
get older,
lips.
they start to get smaller. So I started to do collagen.
Yes.
But the collagen on me, it seems like by the time I get down to my car after the injection, it's gone. I decided to just do something more permanent.
Try a different injection specialist, sis. Okay, so permanent lip augmentation is something that I don't think we see a lot of anymore. I feel like we saw... Did we see someone in The Swan, or was it Bridalplasty, talking about getting permanent lip implants? Or it might have even been Extreme Makeover, actually. And they said, we don't usually do it because you can see the edge of the implant in the lip. That's if it's silicone. So I wonder if there's, like, any other options, or what Dr. Rey is going to say about her lips, because we know he loves to be like,
You're really manly, girl.
Victoria is a Playboy model. She wants a permanent solution to her lips, which are getting thinner. And so we're going to do allogerm. So the short acting are the collagen and Restylane. Then you have things that last intermediate amount of time, 1 to 3 years. And that's alloderm. And that is human tissue. Transplanted, treated human tissue. You're looking awesome today, by the way.
is that fat grafting? That sounds like fat grafting. Human tissue, removed, treated, and transplanted. That's not fat grafting because... Oh, wait, I mean, it could be. It depends if it's auto or the other word. I forget what the other word is. She's got a degree! Right, okay, she's gonna have some alloderm. Off we go, down the boulevard. Here's home. Victoria's home.
Hi, welcome to my home. I'm a model. I was on the cover of Playboy in '95, and since then I've had my own business, which is my website.
Oh.
I have crosses and angels and gargoyles to ward off all the evil spirits. So
I love the fact that we have gargoyles to ward off evil spirits for some reason. But okay, so she has a website. Now, she's a model for Playboy, A, and she has a website, B. I'm completely pro-sex work, by the way, but it sounds like she is a lady who makes titty videos on the internet.
Naughty mummy.
And you know what? Go get your coins, girl.
Negative energy in my house. And here's pictures of all my friends. This is Hugh Hefner with a bunch of playmates and just different events that I go to.
Oh,
and here's my refrigerator with no food but beverages. Tons of water and whatever you want to drink, but no food. These are pictures from...
Sorry, everything to drink but no food. Wow, the mid-2000s really was just like,
want to lose weight? Stop eating full stop. You'll be dead in 72 hours.
Oh my God. These are pictures from my website, and when I do conventions, and I can put a display of all my pictures and sell them. See, I always had big lips. This was before I did collagen or anything. Even though
Okay, so she does make big titty lady videos for her website and then goes to conventions and sells photos. I mean, honestly, that is literally the earlier version of OnlyFans, isn't it?
I model, I shoot pictures all the time.
Pixelations.
I don't do anything for my career. I do it because I like to and I want to. I like looking good. I love being around pretty things. As far as my lips, I love my lips full. They started to get smaller, and I just wanted them full again.
So this is something that actually happens as we age. As we age, the natural collagen in our facial features, especially our lips, under eyes, here, it starts to like disappear and shrink over time. And that means that it will give the appearance of like sagging or smaller or more hollow under eyes or like papery skin. So I can totally understand the want to appear young. It's definitely one of those things though in the modeling world, like you can't stay young and beautiful forever. So it's one of those things where eventually you have to get to a point of saying, do I want to look like how I used to look, or am I trying to just improve the way I look now? And I feel like that's a big, important decision to make because we've all seen certain people, especially certain pop stars, kind of go down this route of generally looking a little bit like uncanny valley because the work hasn't been considered longevity-wise. Do you know what I mean?
This is from Greece, and my friend brought back and said this is supposed to be good luck. So I rub that every night.
She rubs a little willy creature for good luck every night. Da, 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 da. The Four Seasons trashy lingerie. Me. The Tower of Babel. Ooh. A DJ.
My boyfriend's name is Damien Hall, and a lot of people might know him as Crazy Legs from the R&B group Guy.
Crazy Legs. Oh, am I going to get copyright blocked?
She has the walk of life, deadly walk, you know what I mean? And her eyes are green, very beautiful eyes, very stunning. If you're
She
trying
does
to
have
be a
very
model,
beautiful eyes.
Yes, the ideal thing is you have to be this size, you have to be this skinny, you have to be this weight, have this kind of walk, and look like this.
For models, beauty is a business, and we help them stay on top.
She's gonna be that model, I know she is. She's gonna be seen in magazines because she hates losing.
Okay, so the way they're talking about Kimmy's career is that she's getting plastic surgery to enter the space and not to maintain her position within the space. Does that sound right? Is that, would you say I have made an apt observation there?
No.
If my friend was like, I really want to be a supermodel, shall I get 3 different plastic surgeries to start my career? I'd be like, sure, get some plastic surgery only if you want it. Don't hinge your plastic surgery on the idea of getting a modeling contract, because if you still get rejected, you will think, oh, it's because I haven't had enough plastic surgery, I need some more. Rather than just being like, I want to change and improve the appearance of my body or face by this many millimeters in this direction to make myself feel happier in my shell. That is a lot more of a well-rounded vision for plastic surgery, I think, because it is a tool. Remember, it's not an all thing fixes everything. It's not a silver bullet. It is a tool for your happiness. I'm just going to leave it with that. But it sounds like they're saying that she needs this plastic surgery in order to even begin to model, which doesn't, I don't know, it doesn't sound... That doesn't sound like a healthy choice to me.
I love modeling. I miss it a lot. I love doing runway. It's just a passion that I think that if I never tried it again, I just would regret it. And so I want to try it full-fledged.
Try it. See? Try it. Trying it. I don't know. It doesn't come across correct. The surgical center!
I'm hungry, but I can't eat.
Look at those cheekbones. Oh, delicious.
Today's my surgery, getting ready to get all my stuff done. And I'm a little nervous.
Yes.
Goodbye. You won't be looking the same. I am nervous a little bit, but I don't want her to see that. I don't want her to feel confident.
Okay.
And that she's doing the right thing.
Okay. See, that's really sweet. Oh, boobies. That's really sweet to say, like, I'm a bit nervous for her, but I want her to have fun before she goes in. I can understand, you know, they're in a relationship, some light-hearted banter girls about boobies, never seeing them again. Or never seeing the same boobies again, should I say. That's cute. Like, yeah.
Hair is a little droop here, a little bigger. It's a good thing that perfect people have a few little defects, otherwise everyone would hate you. But anyhow, you have the opportunity today to really reverse that.
I'm seeing you now that we're gonna come back in.
Every time Dr. Rey opens his mouth, I'm like, did you really just say that? Are you that misogynistic? Why are you in plastic surgery if you're that misogynistic? Every time I hear him speak, I just think, you could have just not said that. All right. Goodbye.
You're gonna be something different.
What?
You're gonna be something different.
You're gonna be someone different. Right. Oh! Breast crescent lift, augmentation and silicone, rhinoplasty, chin implant, collagen to facial scars.
I hope I can get this implant in here. She's a tall gal.
Oh, right, here we go.
Relatively full implant, but very consistent with the trends here in Hollywood. Damien is in show business, so I kind of understand it, but I'm not sure I can put that large implant in here. We'll see. Well, this is part of the reason why I tossed and turned last night, right here.
Oh.
Can I get that 550 in? See, when all the rest of the world goes...
Oh my goodness. She's getting 550 cc's of silicone as her first boob job size. That's a lot. That's going to give her so much more than like a C to a D. It's about 150 cc's, maybe 175 cc's, maybe 200 sometimes between cup sizes. So she's going way bigger than... She's going like 3 sizes bigger, maybe even almost 4. So the idea that she said a full C to a D earlier, that's That's a lot. And then also that kind of contradicts with what she said earlier about wanting to get back into magazines and modeling, because that's a very full breast for a modeling career. That's what the other lady is doing. That's like Playboy style glamour modeling and not like bridal girls on the runway.
See, when all the rest of the world goes home and rests, the surgeons are tossing and turning, going over the next day's operation in their minds.
I get the pictures of the patient the night before, and I operate on the pictures.
The night
I
before?
work in the garden. I need 2 to 3 hours before I go into the operating room. And I meditate.
gardening
I spend
before
all my
surgery?
time at home, relaxing and prepping myself emotionally and artistically.
Okay.
And thank the good Lord it fit.
That is
So
very
again,
voluptuous.
we say our prayers here because it's easy to pop these implants. Okay, that's it.
My goodness. There was a speculum involved in that.
Cut this piece
Oh
of
my
cartilage out of her
goodness.
nose. If I make just one false move, she will whistle for the rest of her life. That's all, no pressure.
Oh, that really took me by surprise. I thought they were cutting off a part of her nose then. Actually, it was just up here and underneath here and trimming that to reshape it. I was very surprised then.
Quite the scandal, actually.
All right, so now I can just twist it in and crack it. Here we go. Crack. Okay, that's in. We're just looking at everything, making sure that the slightest little bumps are gone. Now we're trying to make her tip a little more refined.
Ooh.
We're putting tip
Don't say
refining
tip.
sutures. So the tip is done.
Oh my goodness. Okay, you might not be able to see that because I might have to blur it, but she has the pussiest little nose ever.
Pussy.
Pussy. All right, here we go.
I'm gonna be nervous until the whole thing is done. Not really for myself, but that she's happy with the result afterwards.
Yes. But this is the thing with plastic surgery, is that it takes time to see the results. And obviously, because you've got anesthetic in your system, because you're going through a huge emotional change with being able to see what's happening in your face, you've got swelling that happens. Sometimes the journey after plastic surgery is a lot longer than the journey before plastic surgery, like psyching yourself up and getting ready to go under the knife, when actually the healing is almost the most important part to look after yourself and the new work and all sorts. So,
IKEA, the wonderful.
Just creating a little
chin
space
implant.
right in front of the bone. So we want a pretty snug fit. Chin implants are not sutured in. We just place them in a pocket until it heals. What a day, huh?
They're not
She looks
sutured in.
super hot. I'm very, very happy with the outcome. Thus far, everything looks perfect.
Okay. Oh, here, Victoria.
I'm here today to get allogerm in my lips.
Allogerm?
What time will it start, do you think?
You'll probably be going into surgery, give or take about 6 o'clock, 6:30.
Oh, because I was having my friend pick me up at 7. I thought my surgery was at 5.
Dr. Rey is running a little bit behind. I think the best thing you should do is maybe call her right now.
I better call her right now because she was going to leave my house at 9:30. I'm so hungry. You know what? He's running late. My surgery is not going to start till...
So her surgery is late, but he was also late to the consultation he had with her earlier. That's a little bit unprofessional, a little bit.
Like 6:30. I won't be out of here till like 9:30. I'm going to have to call Aileen right now. I hope I can get through to her. I just don't want him to be tired from doing a surgery, like running late all day. Oh, I'm nervous. This is kind of a problem. Can I use a phone? Because I'm not sure if my cell phone's working.
No problem.
Between 9 and 9:30. Okay, bye. Hello. I got here at 4 today. My surgery is supposed to be at 5. I'm hungry because I haven't had anything to eat or drink since midnight. I'm already getting tired and can't wait to be put out so I can rest.
She's
And I'm
not had food
nervous.
for ages.
So I'm just gonna take your heart rate, pulse, blood pressure. Okay, so I'm gonna just retake it. Just calm down. You're probably a little nervous. That's why it's a little high right now.
High blood
nervous
pressure.
because
Oh no,
my
no
ride
surgery.
Isn't quite sure when they're coming to get me. I'm nervous that Dr. Rey's had a lot of surgeries today. I don't want to be the one that he's very tired and just sews my eye up or something.
Yes.
Oh, no, I wouldn't say that's going to happen. But actually, the idea that he's doing potentially more than 2 or 3 surgeries per day is a little bit alarming. That to me kind of sounds like he's trying to cram in as much work as possible to get as much money as possible and maybe not considering each patient's well-being as such, because I don't know. I wonder what the normal rate of having plastic surgery is per day. Like, how many plastic surgeries does one surgeon do per day? My hairline was 1 day. My face, I believe all the surgeons just worked on me, but I haven't got confirmation of that. I'm assuming they would have.
Still a little high. Just give me 1 second. I'm just gonna call Dad,
still-
okay? Just so she can check it out.
It's not that high, but it's kind of high, you know?
Yeah.
Oh my God. 3 hours behind schedule. She must be starving hungry.
The delays are common actually in surgery. For the patient, it's kind of a pain because they've been hungry, thirsty, nervous, and the delay just means that torture is prolonged.
The practice has to structure itself so that there is a minimum of unpredictability on the part of the patient. I think we have to think of ourselves as the ultimate service business.
Yes.
We are the patient's servants.
Yes.
And they shouldn't have to wait.
Yes.
Victoria, I'm sorry.
So the idea of being 3 hours behind surgery is ridiculous.
Sorry. Another long surgical day. I'm so
tired. You must be exhausted.
No. I'm used to long hours.
I would not want my plastic surgeon's first words in the room to be,
I'm so sorry. I've just had long hours.
That is not inspiring trust in the service you provide.
Gosh, you look great.
You get very good blood pressure. Very good blood pressure.
With the blood pressure, that was just because of the waiting and just being nervous, I guess, because it became normal right before surgery.
I'm gonna give you medicine, put you to sleep, okay?
Now?
Right now.
Oh, wait. Bye, everybody.
No, you're gonna...
wake up. She's all waiting.
You're gonna...
Nice nap, okay, sweetie?
Well, did she have surgery? What happened? Was he 14 days late? Oh. Da-da-da-da-da. Surgical center, girls. Look how dark it is. Kimmy's in recovery. Okay.
She did very well, okay? She woke up with a little smile. You know, even some of my husbands are not as dedicated as you. And you guys are, only dating, so I'm very impressed. Damien's very concerned. I told him that everything went well.
I remember
just
the
take
packing. That's so
nice
not
nap,
fun.
And I'll see you in a couple of days.
In a couple of days. Right, here we go. Victoria's surgery, girls.
Please. Can I have a forceps with teeth?
3.5 hours late.
So with allogerm,
She's just having a lip implant. 3.5 hours late.
you get a piece of donated cadaver skin, basically. We roll it up neatly, sew it in place so that it doesn't unfold.
Sorry. Allogerm is a donated piece of cadaver skin.
Tonight on 999.
A dead body.
And they make a tube in the lip and insert it through the tube so that it doesn't fold. Cadaver skin. I feel quite lucky that lip filler lasts like 2 or 3 years on me at least.
And then we make a small tunnel with an instrument that spreads a little bit.
Oh my goodness.
And then we reach in, grab the alloderm, and pull it across.
Oh my goodness, it's like rethreading your tassels on a hoodie.
And we hide the edges in the tissue.
Top case, huh?
Just some scarring and so on and so forth. So, boy, she had a lot of bumps from previous injectables. And to try to make her lip even was difficult because there were bumps everywhere.
Wait, so shouldn't she have had her lips dissolved first then, before something as permanent as this? Or he did say it was only like up to 3 years, but like, how can it be up to 3 years? Does your body attack This is a transplant, isn't it? So does your body attack and break down the new lip organ? Oh. I must admit, I know very little about this surgery.
A little bit, right? So I really struggled.
He should have used hyaluronidase and like dissolved her lips first so that he could have had the most smoothest outcome, right?
With her upper lip, I managed the lower lip a lot faster.
Right. Do you know, I actually got botched on my lips from lip filler. And a couple of years ago now, it might have been a bit longer than that actually, I had my practitioner actually put a little bit too much on one side and I had a bump. I've still got a very slight bump now, but I had them fully dissolved. I went to someone new who was actually infinitely better. I had them fully dissolved and we restarted from scratch and I'm so happy with them now. So unbelievably happy with them. And I only have 2 ml of filler in my lip. That's it.
Hi, sweetheart.
Relax deep.
It's okay.
11:30 p.m. Victoria's surgery is finished.
She has to go to bed. What a shame. I missed her.
All right, Victoria.
Oh, wow. Yes, queen. Oh.
Some people are a little more sensitive to anesthesia and will vomit after surgery. This is an area that's very traumatized.
I can't imagine vomiting whilst having literally got like open wounds in your mouth. That is terrifying to me. I bet poor Victoria there is feeling absolutely appalling. She was delayed for 3.5 hours. She was hungry. She was thirsty. She's gone in for surgery and now she's being sick. Just for lips, that must have been a lot of healing. That must have been a lot to go through. And she was 50 years old as well. So now she'll be like 65, I think, 67 potentially. Oh dear. It is true though, like anesthesia will cause all these sorts of like unexpected things. Like I felt a lot of nausea after my facial feminization surgery. I had a button in the hospital that was just like nausea medication, and people would come in and be like, here you go, Lux. So I was much better. That's the one thing I'm not looking forward to surgery in a month's time, is that I hope that because my surgery is kind of like under an hour, I'm hoping that the amount of anesthetic that's needed in my system will not leave me with nausea for a few days, because that is not fun.
Day, so it's a lot stronger than you think.
Oh,
so a little
poor
vomiting is not
thing.
going to bother.
Your lips look amazing though.
No pain, no gain. People understand that it's going to be surgery. There's going to be anesthesia. There's going to be cutting. There's going to be blood. There's going to be gore. It's a trade-off. You're willing to put up with this discomfort to look beautiful.
Okay,
yes.
Take a nice nap, okay? Everything went very well.
It's like beauty trauma. Okay, Victoria. Dr. 90210, she's in the trees. She's gonna get you. Right. This house is having plastic
Surgeries are
surgery.
done on Mondays, Wednesdays, and Fridays. Hi.
Oh, she's back 2 days after surgery.
Hi. Hi. How you doing? I'm okay. It don't hurt. It doesn't hurt at all.
Good. Let me see inside. Open up your mouth.
Oh.
Just want to see if I can see the stitches.
Oh, her lips do look lovely.
So you
They're
said
very
try not
full
to
right
pull
now.
With them with your teeth and your tongue. I know it's probably aggravating. You want to.
I haven't so
Don't
much.
touch. And you said you could wear lipstick too.
Oh, I'm not going anywhere.
Just take a quick shot of
A little photo for the Instagram.
It doesn't look so much bigger than it was anyway.
It looks like she's had a nose job previously, so I'm sure she's probably very, very like acutely aware of what it is to heal from plastic surgery.
It doesn't look so much bigger than it was anyway. The top, I just hope that goes down. I just want to look like I did before, but not have to go for regular collagen.
We're gonna start by taking that little nasty cover off.
Be gross.
Now, if you thought you're going home without any tape, guess again. Look how sexy this mommy's looking, okay? Man, she looks sexy. Look from here.
Yeah, that looks good.
That's a cutie.
You want to see it?
No.
You should want to see it.
She doesn't.
No.
You should.
No.
You should see it.
I was just really nervous to see what I look like, and I just wanted to take some time.
What a...
Oh my goodness, totally relatable. When my nose was first unveiled, I was overwhelmed with like, wow, I can sort of see where it's gonna go, but right now it looks absolutely terrifying because it's a brand new feature on my face. Totally understand that. Completely understand Kimmy's worry there. I don't quite like how he was like, look how sexy she looks. Come and have a look at how sexy she looks. I was a bit like, I don't know, Dr. Rey, you're kind of talking about her like she's a new car or something.
Great call on that genioplasty, the chin augmentation. She was right. Client is always right. Patient is always right.
Okay.
My chin was so big. I look like a cartoon character. I didn't like the way I looked, and it's not what I pictured. I was like, whoa, I hope it's not gonna stay like this.
That is completely relatable. When I had my chin moved forward, it's bizarre how much the swelling here can really change your face shape, because I was like, I turned to the side and tilt down and I was like, I look so gaunt because my cheeks are up here and it pulls in and then swells out and it literally looks like handsome Squidward. Like I was just like, oh, no, that's so shocking. But you have to trust the process. You have to trust the process. You are allowed to have like moments of shock and be like, oh my God, I'm so overwhelmed with how like difficult this process is. And the fact that you don't recognize yourself at first. And also the fact then that you're like, oh my God, I don't look how I wanted to look. I haven't improved. I look worse at the moment. Totally understand. That is absolutely a normal process to go through in the mind. I also, no matter how much prep I did for it mentally, it still kind of shook me. And I would consider myself quite a stable person when it comes to plastic surgery, but still, it still kind of did shake me a little bit. So I can totally understand how Kimmy is feeling there. And it's anyone here who's like debating whether getting plastic surgery, that is something to consider, is that you will have a down after you have surgery, and then you will your mood will improve greatly over time. I am now, what, like 5 months, 5.5 months, nearly 6 months out of surgery, and I am healing beautifully. I am so happy with my results so far, and I've still got a good year of healing before all this little swelling under here goes down, before my tip becomes smaller still, and before my chin finishes in its final like resting place. Oh, don't say final resting place. Death!
Job is to both make people happy and to look better. I don't want to fail. In other words, I don't want to have a successful surgical outcome and yet have the patient be unhappy.
When they're happy, it's a success.
Almost done, you guys. I'm going to develop the pictures real quick, show your progress, go over some instructions, and we're done.
I'm just going to let you know that her breasts are so much larger than a size D. I know that there's like debate around like breast sizes because it also takes into account your band, like the chest band size. Is it called a chest band on a bra? Is that what it's called? Chest band? Chest size? Band of the bra. Band size? Your cup size depends on your band size is what I'm trying to say. But so she had quite a svelte figure anyway. Those bazoomers, big titty lady videos on the internet are bigger than a D, I will say.
You all right?
After your surgery, you're so emotional. Plus, you're on pain medication that makes you even more emotional. Like, I was trying to be strong, but you hold so much in, it's gonna come out at some point.
Your healing, sis, is gorgeous.
For a minute.
How did that get mean?
And trying to prove points.
I didn't say anything. You say something smart?
I didn't say anything smart.
You did.
No.
Oh, she's having a moment.
You guys want to see something cool? Check this out.
Partners of anyone who's getting plastic surgery here, the most beneficial thing you can do is hold your partner's hand and just be reassuring. Just let them know that their concerns are valid and that we will readdress them when they need to be after the healing. Don't start having a little argument with them because it's going to make them feel absolutely terrible.
So you're with it every day so you don't see the change. So let's do it together. Let's do it together.
He's not with me every day.
So now it's here. Oh, a little span, I detect.
But you nurture, and that's awesome. You did a great job with her. She looks great. You, young lady, don't get discouraged because the pills will make you depressed.
This whole thing was a little...
He's really complimenting the boyfriend here while she's literally looking so unhappy. Dr. Rey is like, "You're doing great, sweetie," to the guy. And then to her, he's like, "Don't get discouraged. You're on pain meds. They'll make you sad." Am I detecting a little bit of like Dr. Rey loves men, but in a way that's like compulsory heterosexuality way? He's like really complimenting the men, and then the women that he's just operated on is like, yeah, you're gonna feel like that. Are you getting the same vibe? The more episodes we see with Dr. Rey in, the less I am enjoying him.
Overwhelming. Damien was very supportive. I just was overly being a baby, I think.
No such thing as overly being a baby, sis. You've just had quite a lot of plastic surgery. That's the thing. Your feelings are valid no matter what you're feeling. If they're related to like your personal struggle when coming out of anesthetic and then adjusting to having a new face and body, like if you're feeling a little bit vulnerable and you're just like, I'm worried, I'm nervous. Those feelings are perfectly valid. You're allowed to feel them. Right, here we go. Louis Vuitton, I've got gout, she's a woman. Oh, not a penis. Ferrari, Victoria's home. Oh, here she is.
I haven't shot any new pictures yet for my website. I'm planning on doing it soon. I'm glad I did the allogerm. There were so many things that happened as far as my blood pressure and everything that made it a little more complicated than it should have been.
Her lips look nice.
I love my lips full. I just do hope it does last longer than a year.
Okay, let's have a little look here. So on the left, we can see she kind of had some migration of filler here. I am genuinely surprised that he didn't dissolve her filler before doing an implant. Maybe that wasn't the normal thing to do back then. But like her lips look a good shape. There's a good defined Cupid's bow. They're full. I mean, she is wearing lipstick, unfortunately. It would have been nice to just see a bare-faced after, like we saw on the before here. I mean, they look quite nice. I can still tell she's had work done, but realistically, someone like Victoria is not like, I want to look the most natural lady you can imagine. No, she's got that very 90s Baywatch, bimbo, babe, beauty, playboy look going on, and she pulls it off really well. She's definitely making big titty lady videos on the internet. Diva! Right, now what's all this? Groove theory. Oh!
I don't know what size I wear anymore. I went to Melrose and tried on tops that I would never, ever think about trying on before because I never would look at a top that I couldn't wear a bra with.
That's the kind of shirt you want.
Her breasts are bigger than a D, surely.
I Found these tops that were just great. I was trying them on. I'm like, oh my gosh, look what I look like. It's just an amazing feeling. It's just a new heel. Look how small. Oh no, I don't like this thing. I look like overflowing.
Gotta get used to it, baby. Kimmy looks great, but it's gonna take time for the whole thing to actually fall into place. She looks beautiful right now. So I think the operation was a success.
Okay, that's a very safe thing to say.
I think it will help me out as far as my career goes. I would love to make money off of my new look, and I'm gonna work really hard for it. I'm really ready to go out there, get a great agent, great manager, and get going, hustle.
Wow, that before and after. I don't know how much I can show, but that is a huge difference in chest. And she's got a lovely, in fact, actually, the soft changes to her face profile, nose, and chin is gorgeous.
That's all. Hopefully you'll see me on front page or something.
Hopefully I'll be on the front page.
On the next Dr. Night.
Well, it doesn't... What? I've got some questions and I'm a bit confused there because that just kind of was like, Kimmy didn't get... We didn't see, like... What? This whole Kimmy being a model could have been completely fabricated for this show. Unlike Victoria, there wasn't like, this is me on the magazine, this is me on the runway, this is me on my website, this is this. We were just shown a photo of her in a bridal gown hanging up in her home. And now she's saying that I want to make money from my new look. I think I will be. You'll see me on the magazines. That... Oh, I don't know, you know. I've got some thoughts. First of all, I'm just going to say one sentence. Big titty lady videos on the internet. So should people get plastic surgery to get a modeling career? I think that's a little bit of a question that might require a bit more nuance than just a YouTube video in which I am giving my opinions on surgeries on television shows that involve plastic surgery. I think this would be a great thing to do if you really felt like you had a legible career. I mean, that's kind of difficult to say because, as I mentioned earlier, there is a certain level of sometimes you'll just meet someone in the beauty industry and be like, you think you're going to be a model and it's probably not going to happen, but you're investing all this time, effort, and money into it, and you're only going to be disappointed, shall we say. It's kind of difficult to say that models shouldn't get plastic surgery to further their career because it's going to happen anyway, regardless if I say that, agree with it or not. People will do whatever they need to get a career in whatever industry they want, and only a certain portion of those people are going to be wildly successful doing it. Shall I just leave it at that? I'm going to leave it at that. I will say, though, that I am genuinely quite frightened at the idea of having cadaver flesh implanted for lips. That to me just sounds a little bit much, do you know what I mean? I would say that before looking at more permanent ways of filling an area with filler, I would either change your filler practitioner or have a different look at different brands of filler out there and what their promises are in terms of the longevity of the product. I think nowadays we have like different options as well. We've got things like fat transplant, which is where they take an area of fat on your body, usually from the tummy, distill it, and then inject it into the areas that need to be filled. And I think that leaves about a 60% like fill rate, like your body will absorb about 40% of the fat that's implanted and then you're left with about 60%. I think that's about right. Double check me on that though, my loves. What an interesting episode. We got no look into the family drama of Dr. Rey in this episode, which actually made it a bit nicer, I think. I do kind of wish more of the after was present again though in this show, because Kimmy's after then was just her going shopping. It wasn't like she's made a career now in modeling or she's going to go-sees or she's going to agencies. It was just her and her boyfriend shopping for new tops that show off her tits. And I don't feel like the modeling industry, it depends what branch of the modeling industry she wants to get into, obviously. But like high fashion, runway, editorial, commercial is not necessarily going to always be like,
yes, I love your massive titties.
Anyway, my loves, with that, it's time for the Patreons. Let me know what you think about what we have seen in today's video in the comments box below. And you can see your names scrolling past on the screen right here, my lovelies. Yes, you can. Today's Twitch shout out goes to Ravioli Sim. Thank you so much for following me over on Twitch, you stunning woman on the go. And if you want to be in with a chance of being featured in my next video's Twitch shout out, make sure you follow me over on Twitch. It is Luxeria Plays and I stream 2 nights a week, my loves. Now, because I've had several videos fail this month already, I have actually announced in those videos some new Patreons. So I'm going to go all the way back, and I apologize if I've called you out before or I haven't called you out just yet, and say welcome to my brand new Patreons. Jenny Hemi, Kira Zink, Spicy Onion, Hisa Owl, Jennifer Kettle, Hope Mays, Tootsie Love, Grace, Kimbuktu, Janae Richey, Kitten Janae, Bunny Dearest, Dominic Guillaume, Rinde, Nubis Nebula, and Anya Vamps. And as always, I want to say a massive thank you to my top tier Patreons. Aloria, Luke Peterson, Orkos Emoji, Beebles32, Camille Sarah, Shell Herman, Christy Crownover, Christina Kyle, ContraPoints, Danielle, Danny Smith, Dr. A, Elizabeth Stone, Eric Castillo, Jen Martin, Jenabeth Herman, Jenny Hendricks, Caitlin Wright, Laura Jane again, Les Banana, Lisa Pinnington, Min Mintier, Mariah Sherman, Nixie Tricks, Paula Rivera, Rachel DEC Biscuit, Romano, Ryan Vita, Sexy Texy RN, Slampire Queen, Steffi Tech, Travelful, Tromo, and Victoria Corella. Thank you guys for allowing this Chanel to thrive and survive even when several videos in a row get kind of mucked up. I do actually have another Miriam video on the way. Unfortunately, copyright is blocking it worldwide, and that means I can't even have it on my YouTube channel demonetized because it is blocked worldwide. I think I'm gonna have to make it into like a recap style episode, and I just hope that it doesn't happen for the final. So keep your eyes peeled for that, my loves. And you know what? I'm gonna leave it on the note of make sure you are getting cosmetic surgery for your own happiness, not someone else's. And with that, my loves, I will see you in the next video. Yes.